Hi, my name is Patrick Landash. I am the social worker here at Baton Rouge Rehab. Today we're going to briefly review our policies and procedures with regards to reporting suspected abuse and neglect amongst our patients. Emotional abuse is defined as any act or failure to act by the parent or primary caregiver which leads to serious behavioral, emotional, cognitive, or mental disorders. Physical abuse includes hitting, slapping, pinching, or kicking. It also includes controlling behavior through corporal punishment. Sexual abuse is defined as any act of inappropriate sexual behavior with a child, adult, or elder. Neglect, a form of abuse. It is a failure to provide goods and services necessary to avoid physical harm, mental anguish, or mental illness. Neglect includes withholding or inadequately providing food and hydration, that is, without physician, patient, or surrogate approval, or clothing, medical care, and good hygiene. It may also include placing the individual in unsafe or unsupervised conditions. In accordance with Louisiana law, Baton Rouge Rehab Hospital will participate in the identification and notification to authorities of any suspected child, adult, or elder abuse and neglect. Here are some examples of the professions and roles who are responsible for reporting suspicions of abuse and/or neglect in the state of Louisiana. If you are employed by Baton Rouge Rehab in any role or capacity, you are required by law to report to the appropriate agency any suspicion of abuse and/or neglect. It is not your role to investigate the abuse or neglect. Your role is to make the appropriate report. In those instances where there is immediate danger, call law enforcement. There are 3 categories of vulnerable populations that require mandated reporting. You'll notice that I've included the appropriate state agencies for each category. These agencies are responsible for investigating the reports. The first is for children or anyone under the age of 18, regardless of disability status. These reports can be made to the Department of Child and Family Services. Next is for individuals considered to be vulnerable adults between the ages of 18 and 59 with mental or physical disabilities, or adults of this age who are otherwise unable to care for themselves. Examples include persons with a learning disability or someone who is, for example, comatose following a brain injury. These are individuals whose disability diminished their ability to care for themselves. These are handled by the Office of Aging and Adult Services. The third vulnerable group is the elderly, or adults ages 60 and older, regardless of disability or health status. Elderly Protective Services helps with these cases. A quick word about domestic violence. Domestic violence is only reportable when it applies to these vulnerable populations above. If appropriate, make your report to the correct agency. Domestic violence should not be reported in instances where your patient is considered a competent adult between the ages of 18 and 59 and of sound mind. Resources can be offered to these individuals. Any staff member who suspects abuse or neglect of a vulnerable population is required by hospital policy and state law to report the abuse and/or neglect to the appropriate agency within 24 hours. Case management and the social worker may assist the staff member with making the report, but it is not their role to make the report on behalf of another staff member. If you feel that you do need this assistance making a report, you can reach out to the following individuals in person, via email, or by confidential phone call. Be specific about the request. For example, if abuse or neglect is suspected, include that in your email or voicemail to the appropriate case manager or social worker. When making a report with the appropriate agency, you may sometimes be required to leave a voicemail. In this instance, you can include a callback number. This can be your number or the number of the appropriate case manager or the social worker. After a report is made, be sure to notify the appropriate case manager or social worker for support with any necessary follow-up.
Baton Rouge Rehab Hospital is proud to be a leader in inpatient and outpatient rehabilitation services in Baton Rouge and surrounding areas. We pride ourselves on a commitment to restoring lives through compassion and a dedication to excellence. As the frontline staff members at Baton Rouge Rehab, we achieve these goals and standards through a responsibility to attain the highest level of competence and consideration for the unique and specific needs of our patients. Participating in hospital-wide education and seeking out opportunities to learn and grow as an individual is what can set you apart as a top talent contributor to the hospital. The education provided to you today highlights the 4 values of Baton Rouge Rehab: compassion, integrity, teamwork, and excellence. When you take the knowledge you have gained and apply it to person-centered, excellent care, you are contributing to the excellence of Baton Rouge Rehab. Thank you for your dedication.